Hello everyone. I'm going to talk with the Jim from USA about the hernia surgery, and some other things. Now, Jim, now can you introduce yourself to the people?
Yeah, well, my name is Jim, and I'm from Las Vegas, Nevada, USA.
Okay. Yeah. Now you can talk about your hernia from the beginning and up until now.
Well, when I sustained my hernia several months ago, I thought it would be just a very simple matter of getting it repaired, but I didn't find that to be the case. You have to really do your homework, and the more I looked into it, the more research I did, I found that it's a fairly complex matter because there's so many different procedures out there, and proponents of those various procedures, surgeries, I should say, and it's just very complex, and so you have to. I guess what I'm trying to say is you really have to do your research, because you have to find the right doctor with the right hernia repair procedure, with the right technique, because you have to take care of your body. If you don't take care of your body, where are you going to live? Your health is probably the most valuable thing that you possess, so you can't really take that for granted. You have to really do your due diligence, and in the process of doing that, in the process of doing a lot of research, I came across Dr. Kang. He does non-mesh open or tissue hernia repair, which is not very common in the United States. There's a few, handful of people that still do that in the United States, but for the most part, it's been phased out in favor of mesh, and there's a lot of problems associated with mesh. And so I decided early on that I wasn't going to have mesh implanted in me, because a lot of times the human body rejects mesh because it is a foreign matter. So, of course, I'm sure people have heard about all the lawsuits concerning mesh or whatever. So, in any event, that is the conclusion that I came to, that I was going to have open non-mesh hernia repair, and I decided to have Dr. Kang do it, because he's very experienced. He has vast experience with it. He's done over 10,000 procedures, and like I said, there's a lot of doctors, not a lot, there's just a handful of doctors in the United States that do open tissue repairs, but because it's been phased out in favor of mesh, so there's just a few left. But it seems to me that their repair procedure is more invasive, a lot more invasive than Dr. Kang's procedure. And of course, his procedure just involves like 1.5 incision, whereas in the other case, in the case of these other doctors, it's usually 3 or 4 inches or whatever. And of course, the size of the incision equates with damage, tissue damage and whatnot, nerve damage, vascular damage, and so that's something to take into consideration. I just cannot wrap my brain around the fact that in a lot of instances with these various hernia repairs, they're causing more damage than exists in the first place. And I don't understand that line of thinking. So I guess I'm kind of rambling on here, but anyhow, Dr. Kang is, like I said, he's vastly experienced with his procedure, and probably more so than just about anyone else. He probably does maybe 6, 8, 10 hernia repairs a day, and he's been doing that for years. But what's more important than that is he's very innovative. He's always striving for perfection, and he's always trying to improve his procedure. And so he has innovated, a new procedure which, hasn't really happened anywhere else throughout the world, to my knowledge. He's innovated a new procedure, which I feel is probably a superior procedure because it's far less invasive, and he has less than 0.5% recurrence rate with it. So I would say that he is it is a superior procedure, and that's why I've traveled all the way to South Korea to get it done, because you gotta take care of yourself, you gotta take care of your health,
But your family or your friend didn't like you just fly. It's a long flight from USA here, and how you overcome that?
Yeah, well, I did meet with some resistance, which is understandable because people think that you've lost your mind when when you live in the United States and you're traveling to a foreign country to get relatively common procedure performed, medical procedure performed. They probably think that you got a few screws loose or whatever. But the fact of the matter is, like I said, you really have to take care of your health. So I mean, that's your first priority. That's the most valuable possession that you have, or whatever. And people travel overseas all the time for vacation. So why wouldn't you travel overseas to get a surgical procedure done if that's the best place to have it done? And in this instance, I feel like Gibbeum Hospital, am I pronouncing that right?
Yeah. Gibbeum Hospital, yes.
Yeah, Gibbeum Hospital, which is Dr. Kang's hospital, is the best place to have it done. And so I traveled all the way to South Korea, and it's quite an adventure, it's quite a long trip or whatever. But it was worth it.
Yeah, you are a really brave man and nice. Actually, you have made a right decision, man. Wonderful decision. That's what I think, really. And next question is that you can talk about surgery experience here and the recovery at your hotel room and up until now. You can a little more specify about that.
Yeah. Well, I'd like to say first, one thing I want to mention is there are certainly some good doctors in the United States. I really feel that there are some good doctors. Very possibly some good hernia repair doctors or whatever. I'm not trying to throw them all under the bus, but you have to find the doctor that really is best for your particular case. And if I'm not an advocate of mesh at all. I personally would avoid mesh, but of course that's what's promoted primarily in the United States. So I mean, I'm not a doctor, but I just feel like there's a lot of problems associated with that, and so I'm not going to subject myself to that. And so, but there are some, I suppose, some good doctors that do open repairs. But here again, I know I'm repeating myself, but I just feel like in my case, I think that their repairs were a little too invasive, for me, whereas Dr. Kang's repair was a lot less invasive, and I think that it was very, I had it done about a week ago, or how long ago? What, 5 days ago, and I think it's been very successful. I've been making very good progress, and as far as the procedure is concerned at the hospital here, everything went well. I mean. It's a very streamlined process. I didn't experience that in the United States. Nothing seems to be streamlined there. You make an appointment to get this done, and you wait several weeks or a month, and and then you make another appointment to get that done, and you wait several weeks or a month or whatever, and they don't do it right, so you got to reschedule. And I mean, it's just for me it was a nightmare. So, I mean, I'm just being honest. I mean, that's the way it was or whatever. I'm sure it doesn't work that way for everyone. But here it's a very streamlined process, and everything was done in a day, basically. I mean, I come to the hospital, and they do the sonograph, and they do an accurate and reliable sonograph, and, that's all part of the whole process because they want to find out exactly what type of hernia you have and the location of the hernia. And so they make good use of that technology so that Dr. Kang knows where to make the incision and that sort of thing. And then, after the surgery was done, they put me under local anesthesia. I didn't feel any pain during the surgery whatsoever. And then they took me to the hospital room. You spend a day or a night in the hospital room. And the accommodations are nice, and everything. And the nurses are attentive. And so, it went really well, as far as I'm concerned. And then you go back to your hotel room, on the... I suppose not every case is the same, but I went back to my hotel room after spending the night in the hospital, and so it was a very smooth, streamlined process, and I'm happy with how things went.
Okay, very good. Well, you can talk about some tips for the patients, hernia patients in the world, if you want to say anything.
Some tips?
Yeah.
Well, the biggest advice what I would give to the hernia patients of the world, is do your homework, do your due diligence, and make sure, because you don't want to just go to the first. You don't want to have the first doctor that you see do your hernia repair. Maybe ultimately that might be your decision, but you want to see a few doctors, and you want to do a lot of research on the internet, and you want to learn about hernia repair, because you can't unring the bell. You got to get it right the first time, and so there's really no going back. You got to get it right the first time, because the second time around it becomes more complex, and I certainly didn't want to get on the hernia repair gravy train, I mean, I didn't want to have, my hernia repaired and then have it repaired again, or have mesh implanted,
of course not.
have it removed, and so I certainly wanted to avoid that. As far as I'm concerned, it's a one-shot deal, and I feel like that was accomplished here, and I probably should.
And actually, you come across Dr. Kang on the hernia forum that named Hernia Talk, right?
Right.
Yeah, you exchanged some, writings on and off, and come and go like that, right?
Yeah.
Okay. Yeah.
Yeah, we communicated a lot on Hernia Talk, and there's a lot of good information on there. And he was very generous with his information and his knowledge on Hernia Talk. He, answered my questions, and he answers questions that people pose to him. I just felt like, the answers, he had basically all the answers, well, not all the answers, but I mean, he's a very, highly intelligent, probably a genius or whatever. He's a very intelligent man, so he has most of the answers, but he's also a humble man, so if he doesn't know something, he will admit that he doesn't know it, I was very persuaded by his arguments on Hernia Talk, and he presented his case well for his particular procedure and his particular surgery. And
very good. Yeah. Some American patients don't want to come here for political instability. You know what I mean? So if I go there, dangerous place here, and but I don't think so. Okay?
No, I don't think so. I think President Trump, with the help of South Korea and some other nations, I think he has that all under control. And I think that again, like I was saying, that Kim Jong-il wasn't really. He made his threats or whatever, but I think he was just using that as leverage, to get what he wanted, basically he's getting what he wanted, to some extent, and it serves everyone's interest, not just his, but every country's interest.
Okay, thank you for your political comment either.
Oh, okay.
Okay, now probably this is good enough, right? Maybe we can say that goodbye to the people, right? Okay,
bye.
Bye.